Well, it's a huge problem at the moment with 15,000 cases in a region that's already facing so many other humanitarian needs and so many other health crises.
Some
The
70%,
children are, and,
sorry, yes,
sorry,
some 70% of cases in Congo are in children younger than 15, I understand.
that's correct. The highest amount of cases are with children, and the highest amount of deaths are with children, which is quite unusual at the moment. And so we are deeply concerned about the care of these children, the rapid spread of the Mpox virus, and the many other challenges that children are facing in Eastern Congo.
How much extra pressure does this outbreak put on Congo's, as you say, already struggling health system?
Well, it's an additional challenge. The health centers where we work in Eastern Congo are stretched already with other diseases, whether that's malaria and malnutrition, and to bring Mpox, which is which comes also with stigma, which is so visible, which can be deadly, places just further stress on overtaxed systems, overtaxed families. Many children are living in displaced camps. 7 million people are internally displaced in the Congo. You can imagine trying to control the spread of such a virus in overcrowded camps and in other difficult situations.
So what does it mean now that the WHO has declared the outbreak in Africa a public health emergency?
What it means is the world's attention will now be on trying to prevent the spread of this disease and to help those who do get it. And that's great. I mean, African Union had already declared it a global emergency, an Africa-wide emergency. A global emergency means we will hopefully have the resources needed. Help is needed, help on prevention control, help on spreading messages, help on taking care of those who get the virus, particularly the children. That's what we need to do.
What are the challenges in containing the outbreak? How difficult is it to access vaccines?
Well, right now, that is not unfortunately, that's not the principal means of preventing the spread. There is a very limited supply of vaccines for Mpox. The world needs to scale up production of those vaccines. In the meantime, we need to take the basic steps to prevent spreading the virus. So those messages need to get out. You get it through being in contact with a contagious person. Somebody has a fever. And it is hard to spread if you understand what it takes to spread it. But if those messages aren't out, if people don't know what to do to prevent getting it, to prevent it going to children, then it will spread very quickly. And so that's what we need to do, and we need to do it very quickly.
And we don't really know about the new strains that are popping up yet, do we?
No, and there's still a lot of research that needs to be done urgently. But what we are seeing is it's spreading in communities, spreading in families, spreading through children, not simply adult to adult, which had been sort of the main means of transmission previously. So with spread in communities, it makes it much harder to contain, and why action is needed today.
Do you think the outbreak can be contained? So far, I understand no cases linked to the latest outbreak have been detected outside Central and Eastern Africa.
Absolutely. The world will not be surprised to find cases elsewhere. I mean, but the good news is you can only transmit the virus. It appears you can only transmit the virus if you're symptomatic, and therefore it will be much easier to contain than something like COVID, where you can transmit it asymptomatically. So if we take proper measures, if we do proper screening, if we get in front of this, it can be contained.
Well, it's not the first time an outbreak has hit the region. In 2022, the WHO declared Mpox to be a global emergency after it spread to more than 70 countries that had not previously reported Mpox. Can you recall the experience then and share with us what you know?
Well, like other epidemics, and this one will take a different form from 4 years ago. We know how to get in front of this. We did get in front of that epidemic. But I think what's really important is to understand each time there's an outbreak, each time there's a change in the nature of the virus, what it takes to control. The messages that worked last time might always not be the same messages. The fact that it's spreading communally in families and that children are the ones who are most affected means that we will need different messages this time around to control it.
And no doubt that's what Save the Children is doing. How else are you responding to the Mpox outbreak?
Well, here in Eastern Congo, where Save the Children has a large humanitarian response, we work in health centers, we work in the displacement camps, and we've been trying to, and we work to help the nurses, the doctors, the healthcare providers respond to other diseases. So this is another burden on them, but that's Save the Children is working to make sure that we control infection in the camps, in the health centers, that the health workers have the resources, the protective gear, the disinfection equipment they need, and that the right messages are being spread through communities.
Gregg Ramm, we really appreciate your time and talking to us. Thanks so much.
Thank you.